It's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak in the nation. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation available in English. So right now, we're going to go into the briefing room where Yoon Tae-ho, Director General of Public Health Policy, will be sharing the latest figures and updates on the COVID-19 situation in Korea. So he'll be updating us on the latest number of infection cases, as well as the latest death toll, especially after the sudden outbreak of cases in Seoul's Itaewon district. Well, we've gone into the briefing room now, and as you can see, Director General Yoon Tae-ho has taken to the podium, and it looks like the briefing's about to begin.
Let us now begin our regular briefing for May 14th, Thursday. As of today midnight, we have 29 new patients, and related to the Itaewon Club case, we have 20, and 6 are other cluster infections in the community area. And also, as of today midnight, the total number of confirmed cases stands at 10,991, and out of the total, 9,762 have been discharged. The death toll now stands at 260, and we had one more fatality as of yesterday. I extend my deepest condolences to the deceased and the members of the bereaved families. And today we have a total of 969 patients undergoing treatment, and this was the first time since late February since it decreased below the 1,000 mark. And this is a number that our national healthcare system could manage under full control, and it means that we have been controlling this COVID-19 outbreak to a certain extent. And to achieve such success, we owe big thanks to the live treatment centers that were stationed nationwide, and up until now we had 18 such facilities nationwide, treating over 3,500 people exposed under the virus. And in Daegu and Gyeongbuk area, we have also treated over 3,400 of these people with mild symptoms, which accounts to about 34% of the total of people of the patients in Daegu and Gyeongbuk area. And we had thousands of medical workforce working at these facilities. However, not a single case of infection was reported among these medical experts. And we also want to once again highlight the importance of the sacrifice and the dedication put forth by the medical staff who are fighting on the front lines. Thank you very much once again. And this morning, KCC held a meeting presided over by Vice Health Minister Kim Kang-ip, and we discussed issues on the joint measures that needs to be taken out among the municipalities. And the central government, we highlighted the importance of carrying out the screening testings anonymously nationwide, and we also will also be revising our guidelines so that the disclosure of travel routes of confirmed cases will be revised. So if anyone who have visited these places are hesitating about getting their screening testings, they should get tested immediately at public health centers. And as for the people who work in the education, religious, and indoor sports facilities, as well as those who are working in the healthcare services, including the mental health hospitals, nursing hospitals, all of those working there are exposed to high risk of infection, so they all need to get testing. And during the past week or so, we have witnessed continued outbreak of from the Itaewon Club case in all regions, and the number accounts to 131 as of now. However, the number is subject to change. The government is trying to track down every one of the contacts, utilizing all our resources at hand. And we believe that time is an important matter, and we are also devising multiple policies to tackle against the club infection. And we have also expanded the target of the testings to include all of those who have visited the area aside from the club themselves. And we also have stationed more screening centers in the area, continue as we see a continued increase in the number of screening testings. And in disclosing the information of these confirmed patients, we have revised the guidelines of disclosing their information so that we can to a certain extent protect the privacy information of these people. Just yesterday, 15,000 people have been tested for the virus, and up until now, related to the Itaewon case, we have 35,000 people who have been tested so far. And as for those who have visited the nightlife entertainment venues in Itaewon from 24th of April to 6th of May, we ask all of you to get tested as soon as possible by visiting local public health centers or calling our 1339 KCDC call center. If you are not tested, please be aware that you are putting your own individual public health as well as the health of many others at risk. The government will also continue to carry out and intensify the monitoring and crackdown against these nightlife entertainment venues. As from May 8th, the health minister have issued an executive order recommending that all nightlife establishments suspend operations for a month. And we also put in place executive orders banning the large cluster of gatherings in many areas set forth by each of the municipalities. And as of today, we are also cooperating closely with each of the local police agencies, and we are also carrying out a special crackdown during the late hours of night. And we also have put in place 4 executive separate orders, and we also have identified 23 businesses who have breached such administrative orders. And aside from the visitors who have visited these Itaewon clubs, we are seeing secondary and tertiary infections among their family members as well as their colleagues. So in order to further prevent these cluster infections, we need all of your individual help. Up until now, we identified that we have contacts in the churches and academies, and if we do not keep social distancing going forward, we believe that the outbreak could be even larger. So we ask the members of the public to always remember that you need to take good rest if you feel sick, and wash your hands, and regularly ventilate your space, and also wear your face masks. And for each of the businesses and offices, we advise you to designate a manager who is in charge of quarantine measures. And if someone has suspected symptoms, people need to get screened as soon as possible. And in order to carry out the distancing in daily life, the government is also providing and sending text messages announcing the measures of quarantine, and we are also encouraging our businesses as well to do so. And as of today, we have conducted more than 30,000 monitoring situations for the call centers as well as multi-use facilities, including stadiums. And as for museums, academies, and libraries where there are higher risk of infection, we are also cooperating closely with the local governments to make sure that these facilities abide by the quarantine guidelines. And as the weather is getting warmer, many people are reluctant to wear face masks. However, if you are wearing KF80 or if you wear the cotton masks with accurate manner, we believe that this could help help prevent the spread of the disease. So please continue to wear your face masks going forward. And as for the religious facilities and other academies and public transportation, including other indoor spaces where it could be crowded, the wearing of face masks is essential. And also it is very important to keep distance among each others, and these are also something that you need to keep in order to prevent the further outbreak. And we also highlight that transitioning into the distancing in daily life does not mean that we are coming to an end of the outbreak, and we should not get complacent. And we also need to always cooperate in the quarantine measures going forward so that we put our previous efforts not in vain. So we continue to ask for your participation and cooperation. Thank you very much.
That was a live briefing from the South Korean health authorities that you just heard, urging us to maintain social distancing and also keep our face masks on as the weather gets warmer. We just heard that there were 29 additional cases of COVID-19, bringing the total to 10,991. There was also an additional death, bringing the total death toll to 260. Well, that wraps up our coverage of this morning's briefing. Thank you for staying with us, and we'll be back shortly with our regular midday newscast at 12 p.m. Korea time. Bye for now.